Federal Minister of Health of Somalia, Her Excellency Dr. Jama Farah Hassan, Minister of Health Puntland, Dr. Abdi Fattah Dirie Ahmed, Director of the National Institute of Health, representatives of the Public Health Agency of Sweden, representatives of AFNEC, and of all other partners that have contributed to this event, distinguished guests and conference participants, ladies and gentlemen. Please accept the warm greetings from Dr. Malik, the WHO representative and head of mission in Somalia. He will join us in the course of this conference. I would like, first of all, to congratulate the Federal Ministry of Health and the National Institute of Health for convening this conference, and to thank all the institutions and partners who are contributing to this important venture. Special thanks go to the government of Puntland for hosting the conference and for welcoming us in Garoe. A warm welcome as usual. The WHO Country Office of Somalia is greatly honored to be part of this historic milestone, the first public health research conference organized by the National Institute of Health, which brings together health scholars from across Somalia and from abroad, from the country institutions and the partners. We know that this is the result of very intense and consistent work of scientific and technical committees, and we see them here, who have worked diligently for the past months to set the discussion for these days to be scientifically sound and relevant for the country. And let me say, this is a first step, echoing other colleagues. It's a first step. Today, looking around in this room, we can see how Somalia is on a journey of transformation. And we can see that under this roof we have today, in the next couple of days, some of the best brains, also very young people, for presenting their work to each other. We all know that low-income countries bear the greatest burden of diseases in the world. And still, the share of health research addressing these diseases, this burden, is disproportionately low. This was recognized many years ago and it was defined at 1090 by the Global Forum of Health Research, based on the findings of the Commission on Health Research for Development back in 1990. It was 10% of research addressing 90% of the disease burden. And at that time, we were talking about tropical diseases and communicable diseases in poor countries. Now, we have to say that the situation has changed in the past years. More attention has been given to preventable diseases, and because of the rising awareness that the value of people's health is great for economic development, is critical. And this was well documented in the WHO Commission on Macroeconomic and Health in 1991. More research was focused on the so-called diseases of poverty, and at the same time, global partnerships were established, and they needed to monitor impact of investment. So this was one of the drivers of more research on the diseases of poverty, and was overall a positive move, but still at that time fully dominated by Western scholars. At the same time, also the burden of disease has changed. While we were talking at that time about the communicable and tropical diseases in the poor world, now the situation, the disease burden is converging. And the difference between low-income countries and high-income countries is more on the total burden of diseases, not on the type of diseases. Because we know also non-communicable diseases are increasingly affecting all countries. And this makes even more important looking at the burden of disease, but at the capacity of health systems to cope with this burden. This is why there was a definite move toward more research done by the countries, in the countries. In the more recent years, we heard talking about the decolonization of global health research. And this means strengthening global capacity for research, doing the research in country by country scientists, and using that findings for actions in country. This discussion is very lively at the moment, and the voices from low and middle income countries are heard. They are able to set their agenda, they are able to do their studies, and also to influence the global health agenda. This is very important. But this is still a long way to go. I have to say that I'm very glad to see with this health research conference, Somalia is taking the challenges. You are convening health researchers to share their work, establishing a research network through national and international collaboration. You are identifying the existing assets and the research needs, and setting the ground for the health research agenda for Somalia. WHO Somalia is honored to support and sustain this exciting and demanding venture. As you know, the World Health Organization is mandated to support its member states also in this field. In the 13th General Program of Work, there is included a work stream on strengthening country capacity in data and innovation. And this goes across the 3 billion targets on the 3 fields of universal health coverage, health security, and promoting healthy lives. WHO is keen to support the design and the rollout of the Somali health research agenda, the implementation aimed at informing and promoting effective public health interventions. We know that sound and contextualized research will better equip the country's health professionals to deliver health care according to the Somalia Essential Package of Health Services across all levels of care, from community to specialized hospital, and progress in this way toward universal health coverage. This research will also strengthen the capacity for health security and adherence to the international health regulation, and ensure the country is able to prevent and respond to public health emergencies like the COVID pandemic now. Research will also look at the relevance of social determinants of health and inform strategies to ensure healthy lives and well-being. And I have to say, looking at the draft agenda for this conference, I see that all these elements are already there, and they are seeds to grow knowledge among us. The value of the national research is especially critical to inform the development of national health systems. They are instrumental to achieve the common goods that I just mentioned: healthy lives, health security, and quality coverage of health services. And let me reiterate the commitment of WHO to strengthen leadership, governance, and advocacy for health through the generation and use of nationally owned data for decision-making. WHO would like to call for strengthened partnership and collaboration among Somalia's stakeholders to ensure that the Somali National Health Research Agenda is fully designed and rolled out. We would encourage the National Institute of Health to maintain a pool of trained researchers and strengthen link between researchers and the potential users of their findings, from health professionals to managers to policymakers, as well as the development and humanitarian agencies. WHO applauds the establishment of the peer-reviewed Somali Health Action Journal to facilitate the dissemination of research finding. Finally, I would like to express my deep appreciation and congratulate the organizers of this conference for their commitment, their dedication in the past months, and their vision that today starts to become true. I wish you and all the participants the 3 days of learning, constructing, thinking, networking, also enjoying the company of colleagues, and stepping together into this new journey with a common vision for Somalia. Thank you.